Hi, my name is Donna Nesty, and I'm the practice administrator at Juniper Family Medicine. Today I'd like to talk to you a little bit about our practice's approach to the problem of childhood obesity and the long-term health risks associated through a program called Fit Family Challenge, incorporating the 5210 message and what our practice did with that program. Childhood obesity is increasing at an alarming rate in this country. There are significant long-term health risks associated with childhood obesity. Lifestyle education surrounding a healthy diet and active lifestyle has been shown to be an effective mechanism for decreasing the rate of childhood obesity in certain populations in the country. Utilization of the 5210 message has been part of a successful program at Juniper Family Medicine, and I'd like to talk to you about that a little bit today. The goals for today's talks are, first I would like to explain the guidelines for how we identify children for being either overweight or obese. I would like to outline the 5210 curriculum and how we utilize that in our practice. And then explain how Juniper Family Medicine used that in correlation with the Fit Family Challenge, which was a pilot program that we were a part of, and share with you our exciting data regarding the outcomes of that pilot program. The obesity epidemic in the U.S., the BMI over 95th percentile in children and adolescents ages 2 to 15 is considered obese. BMI is an indicator for the amount of body fat that the body has. It is typically weight in kilograms divided by height in meters. So if a child is at a BMI that is higher than the 95th percentile for their age and sex, then they are considered to be obese. BMI at greater than 85% is considered overweight and is at risk for moving into a status of obesity. There has been a significant increase in obese children and adolescents since 1999. In 1999, the amount of females in that age group who were considered to be overweight or obese was 14%. It is now up to 16% and continuing to increase. For males in the same age group, also in 1999, we were looking at about a 14% rate of overweight and obese males in that age group. We are now, since 2004, where it was 18%, continuing to increase. There are many long-term health risks and chronic diseases associated with childhood obesity. Obese children are very likely to become obese adults, and with that come some comorbidities or some long-term chronic health diseases. Some of these include hypertension or high blood pressure, diabetes, cardiovascular disease, osteoarthritis, depression, sleep apnea, and some cancers. So as you can see, for our country as a whole, childhood obesity is a very serious health concern, and it's something that across the country practices at a primary care level are trying to find solutions for. The 5210 message is a curriculum which instills healthy boundaries for diet, exercise, the amount of sleep a person gets, and the amount of screen time that children are spending. And we incorporate screen time to include phones, computers, television, video games, etc. It is incorporated into a community health education program, and it provides a level 1 intervention to encourage lifestyle changes which can impact health over a long period of time. The guidelines for 5210 are 5 servings of fruits and vegetables per day, no more than 2 hours of screen time per day, 1 hour at a minimum of physical activity per day, and 0 servings of sugar-sweetened beverages. When I first learned about this curriculum, I was interested to discover that juice is actually considered a sugar-sweetened beverage. So we included that in our recommendation and asked families to cut out juice as well. Fit Family Challenge and 5210. The Fit Family Challenge is a program that was created and is funded by the Colorado Academy of Family Physicians, and it incorporates the 5210 message into a series of group visits to educate families and children who are at risk for childhood obesity. To be considered for part of the Fit Family Challenge, children had to have a BMI over the 85th percentile, and it was open to them and to their families. It was made up of monthly group visits, which are centered around the 5210 curriculum, and incorporated a different aspect of that curriculum into each group visit. Weekly contact from a health team member to provide phone support or email support to these families on a more consistent basis than the monthly visit was also provided. And then weekly goals are set by the family based on the 5210 about lifestyle changes that they feel they can incorporate into their life. As I said, it's funded by the Colorado Academy of Family Physicians. It was piloted in 21 primary care practices across Colorado, including our practice, Juniper Family Medicine. And the pilot time frame was from January 2012 to December 2012. Our outcome from Fit Family Challenge and the 5210 message had both significantly statistically significant clinical outcomes as well as behavior modifications. The clinical outcomes included our BMI average for the children in our program decreased from 93.7% to 93.5%. Their systolic blood pressure decreased from 104.62 to 98.18, and their diastolic blood pressure decreased from 65.05 to 63.59. However, what we felt was even more significant than the clinical outcomes were the behavior outcomes that we saw from our kids. The servings of fruits and vegetables increased from 3.3 to 3.7 per day. 1 hour of physical activity a day increased from 3.44 times per week to 4.37. Family physical activities increased from 2.45 to 2.73. Hours of screen time per day actually increased, which was not what we expected, but I do think we have an explanation for that, from 2.45 to 2.73. And the intake of sugar-sweetened beverages decreased from 1.13 per day to 0.555. And what we found with the screen time was that many of the children, especially here in Colorado during the long winter, one of the ways that they incorporated activity into their day was doing active video games, so things like Wii Fit and some of the Dance Revolution type video games that actually got their heart rate up. So when you added an hour of that per day, it also increased their screen time. So that data was a little bit misleading. So our conclusions were that childhood obesity and associated chronic health conditions are definitely on the rise, and that as a primary care practice, we are very interested in addressing this issue and offering some long-term lifestyle changes to our patients and their families. Lifestyle modification education like 5210 in the context of group education can have a significant outcome, which we certainly think we saw over just a matter of 1 year time. Small lifestyle changes have the potential to significantly change health over the course of a lifetime. As I stated at the beginning of this talk, this is considered a level 1, at most a level 2 intervention. So we are not this is not fat camp. We are not expecting to see these kids drop huge amounts of weight. What we're hoping to do is plant some seeds for some long-term healthy lifestyle changes that they can carry with them over the course of their life. Juniper Family Medicine will expand our Fit Family into the community this year and continue to offer this to patients in our clinic and in other clinics across the valley in 2014.